Good morning, good afternoon, good evening, from where you are. You are most welcome to our first Africa Regional Health Challenges Committee webinars. My name is Muhammad Mudabbal. I'm a community health nurse from Sudan. Together with my colleague Tess Nawagi, we are co-chairing Africa Regional Health Challenges Committee. Today's webinar will be about mapping Africa's nursing governance and leadership documents. Thank you all for taking the time to registration and taking the time to attending this fruitful webinar. Today we'll have a fruitful speakers and panelists that will joining us for today's session. We're going to start with our first speaker, Ms. Prof. Lisa. Prof. Lisa is the Program Director of Nursing Now Challenges, Program Director of Nursing Now Challenge, and Pro Vice Chancellor of Coventry University of Life Science and Health and Life Science at Coventry University. Also, Prof. Lisa has proven record of clinical work experience in both in public and private sector for over 20 years. Also, she has been one of those passionate about development of modern nursing. Prof. Lisa, it's over to you for opening remarks.
Hello everybody. I'm sorry I can't be with you in person, but I'm delighted that you're coming together to have a really exciting conversation and knowledge exchange about the brilliant work that Faith is doing with colleagues around understanding the challenges and opportunities for leadership development for early career nurses and midwives across Africa. It's my deep privilege to be the Programme Director for the Nursing Now Challenge, and I'm always amazed, surprised and enthralled by the brilliant work and the energy that you bring to the table. Thank you very much. I'm wishing you a great session, and I look forward to hearing all about it in due course.
Thank you so much, Prof. Lisa, for this brief opening remarks and encouraging rewards regarding recognizing our work as Africa Regional Hub Committee's members. Now we will move on to our next speaker, which is Monisi Neka, is the former Board of Nursing Now Challenges Committee Board of Directors. Also, Monisi is a registered nurse from Zimbabwe, is a global health advocate and human rights activist. She has a proven record of experience of developing community outreach in Zimbabwe. Monisi will give us an overview about the Mapping African Nursing Leadership and Governance document as a keynote speech. Over to you, Munishi, to share your experience regarding this important topic. Hannah, could you please raise the sound?
Hello, everyone. And thank you so much for this opportunity to be able to speak to you today, and really just to appreciate this topic that we're talking about leadership and governance in nursing and midwifery in Africa. And I feel it's a major topic, and it's a really great topic that we're going to be discussing on today, and really looking forward to the outcomes that will come out from these discussions and this webinar. So to start off, we're talking about leadership and governance. I'd like to start with a definition, and a definition that I like to go by, and it's a definition of leadership. So with regards to my perspective, I feel leadership is the ability to facilitate and guide collaboration. And I talk about collaboration because I feel collaboration happens on many levels. Collaboration happens internally, so within a body, being able to assist and guide for the body to work together. So being able to encourage all the different parts of that body to collaborate and work towards a certain goal. Also, collaboration happens externally. So being able to facilitate new outreaches, being able to facilitate new strides, and being able to encourage collaboration towards a better and more holistic form of activity. So that's my definition of leadership. And through that really comes what it means to be a leader. and the ability to be able to influence collaboration, to be able to influence others, to be able to do something and work towards a common goal that you have as a body. In terms of governance, governance, in my perspective, is mostly to do with policy. And governance and leadership are intertwined. That's when you create policies. It really takes leadership in being able to encourage people within your community to be able to follow those policies and to develop policies that are inclusive of everyone and that everyone feels they have a voice in and be able to participate wholly in. So governance and leadership are intertwined, and it develops opportunities to be able to create leaders through governance within a body by developing policies that people can be able to get involved in and be able to raise their voice in as well. With regard to leadership and governance in Africa, I feel there is a lot of strides that have been made, and there is a lot that has been done to ensure particularly that we have CNS, Chief Nursing Officer, within each country. And I think in terms of most African countries now have a Chief Nursing Officer, which is great and which is an amazing stride for nursing in Africa, because it's the start of being able to encourage a lot of this collaboration and to be able to push nursing in Africa forward. In terms of nursing and midwifery in Africa, it's really governed by the 4 pillars of nursing. These 4 pillars are the backbone of nursing, and they encourage and direct really how nursing functions and how nurses are able to participate and engage in terms of day-to-day activities. The 4 pillars of nursing in Africa are namely the policy, which is mainly done through ministries of health, the Chief Nursing Officer, and being able to guide the policies in the country in terms of nursing and midwifery. The second pillar of nursing is education. So this includes universities, training schools that are able to recruit nurses, train nurses, encourage research, being able to promote nursing and encourage nurses to be able to involve in different courses and different programs. So the second component and the second pillar is education. The third pillar is regulation. So that is your councils, your regulatory councils. And this pillar really guides the scope of practice, really guides how nurses function, whether they're able to be registered on the nursing roll, and being able to ensure that nurses are able to contribute and work effectively, safely within their environments. And the last pillar is mainly welfare, and that's mostly ensuring that nurses are taken care of, that nurses' voices are heard, that nurses are able to contribute directly to the policies that affect them. And this is mainly done through the associations that are within country across Africa. So when you look at it, all 4 pillars are essential towards ensuring that nursing is effective across the continent. And talking about leadership, the only way that we can be able to push nursing forward within Africa is by encouraging collaboration around and within these 4 pillars. encouraging that each of these pillars are able to contribute effectively, have an equal voice, and are able to function within their scope as far as possible, and to ensure that whenever there is a motion that is passed by any of the four pillars, all other pillars are behind them. So talking about collaboration, being able to ensure that there's collaboration between these pillars, and these pillars are able to strengthen each other, are able to promote each other, and are able to advance nursing within Africa. In terms of being able to coordinate and function, there are certain bodies that are there that are encouraging for these pillars to be able to function together. I know Exocon, that's the East Central and Southern African College of Nursing. And basically this is a body that assists in being able to collaborate and encourage the four pillars of each country in Africa to work together and come together as part of this body, Exocon, and being able to encourage collaboration between countries as well. So that's really amazing in terms of the work they're doing there. And I'm sure, I think there's also one, there's a West African one, a West African College of Nursing. And I'm not really sure if there's a central or a northern one as well. But this is just basically an example of collaboration and how collaboration is actually working. Another platform that is available in terms of collaboration for leadership and governance in Africa with regards to nursing and midwifery is particularly through the ICN, and being able to have associations contribute, associations being involved, and being able to collaborate with other associations. And through the ICN as well, and through as well the WHO, there's also the Triad Meetings. So the Triad Meetings are also particularly an opportunity for collaboration, an opportunity to advance leadership, an opportunity to advance collaboration, and an opportunity to be able to ensure that each pillar has a voice and nurses are able to contribute not just on a regional scale, but also on a global scale as well. So these are basically platforms that are available in terms of collaboration, in terms of leadership and governance for nursing and midwifery in Africa. One aspect that we really need to work on as a continent is being able to encourage leadership training among newly registered nurses across the continent. And that's something I am personally very passionate about. It's something that I feel that there's a lot of work to be done to be able to encourage leadership training and availability of leadership capacity as well, to be able to ensure that nurses, once given this training, are able to utilize it as far as possible. So that's one aspect in terms of work that really needs to be done in terms of leadership and governance in Africa. And there are so many platforms that have started working towards this as well. You look at the ICN as a leadership course that they provide. And also, there are a lot of really other groups as well that are providing leadership courses to be able to encourage leadership training. Particularly, we have Nursing Now and the Nursing Now Challenge, which has been an amazing platform to encourage leadership amongst young leaders. So being able to ensure that young leaders actually have the training and are able to get involved, particularly with this African Region Hub. So that's sort of like the crux of leadership and governance in Africa, and where I feel personally that there are gaps and where we can be able to get involved. I really want to thank you for your time, and looking forward to be able to see the outcomes from this meeting and being able to ensure that there is a leadership voice. Young leaders are able to effectively participate in leadership and governance in nursing in Africa. Thank you so much.
Thank you so much, Munishi, for such nice speech. You highlighted the importance of nursing leadership and governance documents by beginning by defining the nursing leadership, what's highlighting the importance of having nursing governance documents in African countries, also highlighting the importance of having chief nursing officers and having a good and appropriate regulatory bodies that will regulate our work in the African countries. Also, she is emphasizing the importance of having collaboration between African countries, such as Eastern African Nursing of College Federation and Western part. Also, she emphasized the importance of having collaboration in regional aspects through international aspects, through using ICN, through using WHO platforms and otherwise. Thank you so much, Munusi, for that nice speech. Now we'll move on to our third part of webinars, Introduction to the Nursing Research Team Lead. We will begin our introductory phase by introducing Borofruzi. Borofruzi is the director of Coventry University Healthcare for Research. Through her year, Borofruzi started as a registered nurse. She worked as a researcher, worked also as a teacher at both Salford University and Birmingham University. Borofruzi, it's over to you to give us an introduction regarding our project.
Hello, everybody. It's very nice to be here today, and I'm going to hand over fairly quickly to Faith in a second, but I'm very happy to meet you. My name is Rosie Nevesey, and I started my career as a registered nurse working in neurosurgery, and as a new graduate nurse, I could see very early on the need for nursing leadership to support new qualified nurses and those nurses who'd been working for quite a long time, to help them to use the best evidence in practice to support each other and to help us achieve the best patient outcomes. Through my career, I've been involved in education and research, and I think my most exciting projects are about nurse education and how we develop the profession and to take people with us so that we're an empowered profession that's dedicated to securing improvement in patient outcomes and professionalisation of nursing. So I'm very pleased to introduce Faith, who's going to tell us about the research that is being led by Faith and her team. I am an advisor on that project, which I am learning a lot about as well. I'm learning from Faith and the challenges of nursing, but what I'm seeing is a great momentum amongst African nurses to take forward nursing leadership, and that is going to be absolutely amazing in so many ways. So I look forward now to introducing Faith so she can share the project more specifically.
Thank you so much, Professor Rosie. To the team and everyone attending today, we truly appreciate your presence here. My name is Faith Nawaji. I'm a Ugandan born and raised here. I'm a nurse by background and currently doing my PhD in health professions education with a strong affiliation for governance and nursing leadership and all that. With that said, colleagues, I would like to highlight that we are grateful for the support from the Nursing Now Challenge team back in the UK to enable us have a platform to really advance some of these agendas that we think are critical to this continent in Africa. We are very grateful to the Coventry Center for Research, Healthcare Research, forgive me if I'm not pronouncing it right, for really the support on effectively advancing this program in the most well-supported way in terms of operationalizing it and all that. We are very grateful as well to the Budget Trust Nursing that has provided the mini grant to advance this program. Colleagues, as my previous speakers have spoken, the importance of collaboration is pretty much very evident in many ways that we live, in many ways that we interact, and in many ways that we would want to see ourselves in the near future, or what we would like to see for our profession as nurses in the future. I would like to reflect on our day-to-day life here in Africa with a short video that shows how collaboration leads to innovative approaches that really benefit everyone across the continent, the community, and all that. It's pretty much a video that is going to show the basics of how, from a small unit in the family, we then see the evidences coming out as a road being developed and then electricity being developed. But it all started with a unified approach of doing things together. So I'll share that video, a short clip, and then I'll move forward to what our agenda today is all about. Share sound.
Today I woke up so early.
Hurry up, get everything ready.
Today I woke up so early.
Hurry up, get everything ready. I'm not serious. Check on the dining, check on the dining. Are your books ready?
Yes, yes.
Pick your bags up, let's go.
So how about this?
I like that. Bye, sweetheart.
Don't worry, he'll be back.
That's why he always going.
Well, today he's going to help build a dam.
Why?
So the dam can create electricity and Mrs. Mugisha's children can do their homework at night.
Wow, Daddy does all that? What else does he do?
He's helping to build a highway.
No way.
Now, Mr. Pio can transport watermelons and earn money for his children's school fees. Daddy helps people create new homes and grow their businesses.
But I thought Daddy was a banker.
Yes, he is. He works at Stanbic Bank.
For us, improving lives is why we do what we do, because a better tomorrow starts now. Stanbic Bank, moving forward.
All right, so colleagues, why did I choose to use an example of what Stanbic Bank is doing to advance lives? Because Stanbic Bank is common to many of us here in Africa. In Southern Africa, it's mainly referred to as Standard Bank. In East, it's Stanbic Bank, I think, and similarly to the West. But when you look at this video, what are they trying to say? That we are interlinked in one way or the other. And if we work together to identify the need of what it is at hand, then at the end of it all, it will be an ultimate benefit to improve lives for everyone. So if a financial institution is looking at it that way, I also believe that as a team today, through the Nursing Now Africa Hub, we'll be able to work together to pave a clear understanding of nursing leadership and governance situation across this continent. So I'll go straight now to the overview and to the slides. All right, so to begin with, what is this project about and all that? This project is titled Mapping the Nursing Leadership and Governance Documents in Africa. And what do we aim to do? This project aims to establish each country's state in line to the existence. It's one thing to exist, but also the operation of their nursing governance documents or leadership, which is the nursing leadership at hand, just like Munashi said, in terms of the chief nursing officer, the registrars at the council and all that, the nursing policy, which is commonly guided to be implemented through the nursing strategic plan, the scope of practice, which really defines what each cadre will be doing as per their professional training. If you've trained as a certificate nurse, what are your roles in that domain? If you're trained as a diploma or bachelor's nurse or master's nurse and all that, what are your different roles in that way or the other? And when we are in the hospital, is nursing really appreciated at those different levels of practice or training? Or when we are at the hospital realm at the front line, we are all nurses and there is no difference between your roles as a bachelor's nurse or a certificate nurse and all that. We just want to articulate and know what it is in every country. Then the schemes of service that really guides deployment in the different health hospitals, as well as the code of conduct, which really governs our ways of behavior and professionalism in line to the ethics attribution of the nursing profession. Why are we doing this? Is this really important? Will it contribute anything to us? We think this program will contribute to policy development and highlighting gaps for investment in Africa's nursing organs of leadership. It's one thing to have a document existing, but is it operational to the grassroots? Is every African in every small village really getting care from the right nursing cadre or in the right ways that it should be offered to them through the structures of governance and leadership? So how will we do this? Colleagues, this is a research study and it will be done with a cross-sectional design, meaning we shall interact with the focal people in each country at one point in time. We shall not be doing it as a longitudinal. We'll do quantitative methodology, meaning we shall use numeric approach to quantify our findings in the domain of frequencies and percentages, and seeing where, if there are any relationships in different regions of this continent through the bivariate and multivariate approach of analysis. We will also do online data collection. We will build this tool that we are going to use to assess each country in an online platform called Microsoft Forms, and the link will be shared to the different country focal people. We will then do analysis using the SPSS IBM software and then draft the results through, of course, we'll have a dissemination workshop and then develop a report and publication. And our hope is that we shall publish in BMC Human Resources for Health, because this is something that falls in that continuum of the journal scope. So then the question, where are we going to be? What's the country coverage? And why did we choose these countries anyway? So we'll focus on 17 countries in Africa. Why? Because these are the countries that are actively participating in the Nursing Now Challenge on this continent. And therefore in East Africa, we will be in Ethiopia, Kenya, Uganda, Rwanda, Tanzania, Burundi, and Sudan. In West Africa, we'll be Nigeria, Ghana, and Sierra Leone. And in southern part of Africa, we'll be in Malawi, Namibia, Lesotho, South Africa, Zambia, Zimbabwe, and Botswana. So where have we reached? What's the progress thus far? Colleagues, I would like to say that to begin with, we have project advisors, Professor Rosie, who is currently present with us, and Professor Sheila Tlu, who had a government engagement, so she couldn't be here with us. But in line to that, we've been able to secure a mini grant from the Budget Trust Nursing, fully supported through this process by the Nursing Now Challenge team. Thanks so much, Andrea and Hannah and Professor Lisa. We have work being supported through the Research Support Center of the Coventry Center for Healthcare Research, led by Professor Rosie, and they are helping us very I must say, in a very appreciative manner for their library service to do authentic search through CNIL on this topic to enable us guide our analysis as well as development further. We have a proposal and tools developed. We have got IRB approval from Africa. We have developed the data focal team from 17 countries. We had to choose one per country. So we had applications from many people from one country, but we had to choose one person, given that the limited funding is indicated in our mini grant. Then the tool to use for data collection has been built in MS Forms, and it will be piloted before it is disseminated to the different country focal people. What are our next steps? Currently, we are doing ongoing orientation for the data team. They have received the orientation profile write-up of what the program is about, what is expected about them, what will their compensation be like, how should they collect data. They have been given, as per the ethical principles, the informed consent form to really familiarize themselves with what this project is. And by the time they begin to participate, they understand what it is all about and provide their consent. We've also provided them with a draft tool of how it will look like, how it looks like on paper, but this is ideally what will be in the online application form. Colleagues, our data collection commences on 21st of March, which is this month, and it's a few days away. And what are our project timelines? It's pretty much we are going to begin data collection this month, as per the date mentioned. We'll then clean the data. From cleaning the data, we'll then subject it to analysis to enable us to understand what it is in every country. We'll then draft a report and manuscript between July and August, and then focus on dissemination of findings through a workshop, a publication, and a report to all the key stakeholders of the nursing profession across the continent and internationally. It's our wish and hope that during the dissemination, we'll have the WHO Afro Health Workforce nursing and midwifery representative probably present, the ICN leadership, the Hexacon leadership, the West African College of Nursing, and all other key stakeholders in the different countries, the presidents of different associations, the chief nursing officers, the registrars, and all that. Colleagues, I would like to end with a small proverb, which is common to us here in Africa, but which really depicts the need for us to work together if we really want to see change in many things that we are doing. And in that case, the saying is all about, if you want to go fast, go alone. But if you want to go far, go together, but most importantly, without leaving anyone behind. So colleagues, as for this project, we think it's not important to only map what is existing in Uganda as a country, or what is existing in Kenya, or what is existing in Lesotho or South Africa or Botswana independently. We think that we can be able to go far and develop a really strong advocacy voice if we work together in a unified way to come up with a big data on what is happening across this continent. I would like to end by saying thank you so much for attending, and for the data team and all that. We look forward to working with you, and we believe that this is going to be a journey of us finding out, but also enjoying learning from each country and understanding the best practices across in the different nursing cadres in the different countries. Thank you so much, and over to you, Mohammed.
Thank you so much, Faith, for such a brilliant presentation and giving an overview regarding our recent project. I'm pretty sure that project is going to make a huge difference in the African continent in terms of providing documents and nursing leadership in all African countries. Now we will move on to the part of our discussion and Q&A session. I have one question to you, Prof. Ruzi. From your point of view, to what extent do you think this project will make an impact and a huge change in the African countries in terms of service provision, in terms of developing nursing futures in Africa? Over to you, Prof. Ruzi, to hear about you.
So I think this is a really important project for a few reasons. I think it's really important to bring nurses together to solve problems together. And it goes back to the earlier point about collaboration. Working together means we can combine our skills, our knowledge, our ideas, and solve the issues that we face. And we know that nursing has a huge impact to make globally. But we also know that in many countries, nurses aren't supported or recognised or empowered, and there's a lack of nursing leadership roles. It's really important that nurses are supported and empowered in order to take up those leadership roles or even begin to create them and argue the case for those roles, because in some situations, it's not even recognised yet how important nurse leadership is. So we need to create the argument for nursing leadership positions. It's fantastic that most of your countries have a chief nurse, and the figurehead is really important because it brings the voice, and through the figurehead and that voice, we can start to advocate for patients, for the populations that we serve, but also we can advocate about the importance of the profession and its activities and what difference it can make to population health outcomes. So I think this project's very important because it brings together nurses from across, I think it's around 16 countries, to think about nurse leadership, to think about governance, to think about what structural support we need to empower and support nurses. And I think bringing those people together is really important for those individuals, but for the professions in those countries more widely. Because actually to really professionalize nursing so it can make maximum impact, we do need infrastructure, we do need policy and guidance, we need a benchmark to work to. And it's really a really good idea to map what benchmarks and policies and guidance exist and to start to compare them and contrast them and learn from each other. So I think it's a very important project in terms of empowerment and support. And we know that for empowerment to really happen, for people to feel empowered, we need both structural support and psychological support. So I think that this project is going to have an impact at lots of different levels. Those are my thoughts at this stage.
Thank you, Prof. Ruzi, for such nice answer regarding the question. Now we'll move on to Faith Nawagi. Faith, for your expectation for this project. To what extent the findings and the outputs of the project will gonna shape the future policies of the African countries and we're gonna shape in terms of regulation bodies, and to what extent this project outputs will guide us to be utilized and to achieve African vision towards UN Sustainable Developmental Goals for 2030. Over to you, Faith.
All right, thank you so much, Mohammed. And how will this project help us and how will we really utilize the outcomes of these findings? Colleagues, I believe in going together, but most importantly, without leaving anyone behind. So when we have these findings and all that, it is upon us to not lose the spirit of unified achievement across Africa, not only in Uganda or not only in Sudan and all that, but how can we use this as a starting point to be a momentum for a unified nursing advancement in all levels, so that it's a unified voice if we go and advocate to WHO or to ICN or to Hexacon and all that. So how shall we do this? Together as a team during our dissemination, we should not disseminate these findings to us as us. Let's invite everyone who we think that should be able to make a decision about the nursing governance and the nursing policies to be part of the dissemination and all that. And to me, that will be key in seeing that we get the results not only to ourselves, but to everyone and all that. How will we use these and how will this impact us? I believe there are very many countries across this continent that have good practices happening and things that are going on in the right way in their country. This project will enable us understand and highlight what is that country that is doing it well, and therefore beginning a journey of benchmarking in our own African strengths, in our own countries that have done it with their limited resources, and therefore different countries benchmarking from what is financially feasible within their continent, within their country and all that. How shall we take this to the global level and advocate and all that? It would be good actually if at the point of dissemination and all that, we have a report that is coming out, but also task if the ICN president attends and all that, how do they want to use these results, not only to put on the shelf, but to see that it is something that it can be as an outcome incorporated in their strategic plan and all that. So those are some of the ideas of my head, and over to you.
Thank you, Faith, for such a nice questioning regarding future using of the results of research. Now we have a little bit questions from the audience. Zipporah Iragi is asking about what roles can those of us who are not in the data team play to contribute to the research project. I think this is quite a bit relevant to you, Faith, to take the question. The question is about the roles of the other members of the Challengers Hub committees that are not involving in the data collection as their country. So what's their role to contribute to the research? Faith?
All right, thank you so much. For those other members that may not be part of the focal data people, maybe it would be good to co-introduce them to the person that is doing the data, the focal person, so that maybe they jointly work together on this topic and see that they harmonize their country output together. The only issue with that is how to sort out the logistical bit of, since in the budget, we actually only have a budget for one person, but it would be good to see if the two can work together, and if any focal person today present would be up to share and work with someone to produce their country profile in the system, please feel free to reach out to us so that way we can have a unified approach. Beyond that, I think as we map and understand what is happening and all that, together as a team, those involved in the research and those who are not and all that, maybe it is high time we think of how do we then develop a joint online presence about the work that we are doing. At least we had the board meeting and we had approval to develop a social media platform and all that. So Mohammed will be handling that and all that. But it's key for us to keep generating ideas on how we can advance and continue to be involved. And we have WhatsApp groups. Please join them and give your ideas. And together as a team, we shall go far without leaving anyone behind and all that. Yeah.
So thank you, Faith, for this brilliant answer. Now I have a question from other participants. Salah from Egypt. She's asking, does Egypt include it in this program? I guess over to you, Faith, to answer this one, because it is something that...
Yeah, so this list was developed in consultation with the Nursing Now leadership in the UK. And unfortunately, we don't have Egypt on the list, but it could be something up for discussion if Egypt is interested and is actively participating in the Nursing Now activities. I will get in touch to check with Andrea if there is a profile, and then we contact the people active in Egypt. Yes.
Also, I would like to add something, Faith. I think Egypt is a part of EMRO region of Nursing Now challenges. So
yes, and there is a conflict there as well. Egypt is considered Eastern Mediterranean region.
Yes.
Despite the fact that we are all in Africa, but most Northern African countries are considered Eastern Mediterranean region, and only 47 countries actually subscribe to WHO Afro, with only Algeria in the north being on the Afrobeat. So this is something that we need to understand logistically with the Nursing Now team if we should include Egypt, basing on those parameters of what is present at hand.
Okay, Faith, that means this point will be open to discussion with Nursing Now Challenge Board, and we'll get feedback to those and the Africa Hub Regional Committee members. So I'm seeing Prof. Rosie is raising her hand. We have a lot to add to this. Prof. Rosie, over to you.
Thank you. It was a comment for Nancy. I'm reading that she's working with nurses in Moldova. I did a project last year with nurses in North Macedonia. There may be some similar issues, possibly for nursing between those two countries. We did a project with the WHO, and we set out a 10-year roadmap for nurse education. And I could send that report to Nancy by email. We didn't use a data collection tool like Faith's data collection tool, but we ran a number of interactive workshops with nurse leaders and ministers and clinicians and educators. It was in the hard part of the pandemic. It was all done online, and we had simultaneous translation. It was a very useful process, and there was lots of discussion about the lack of a regulatory body in North Macedonia, and they are looking at a chamber of nursing. So if that's helpful, Nancy, I'll send you that report, because it's on the WHO website, but I'll just send you it because it's hard to find. There's so many reports.
Thank you, Rosie, for this informative information regarding the report that we're going to be shared with Nancy. So for the other participants we have here, we are opening the floor for Q&A or for discussion. If you have any comments or adding, you can raise your hand or just type it in Q&A or type it in the chat so we can pick up to our panelists here to have more inputs regarding it. So any question, comments from participants? Meanwhile, for the comment section and Q&A section, could you briefly give a brief overview about the steps of doing the data collection and suggested date for those who have been selected to be a focal person for the country to receive the online training regarding data collection, and the tips and tricks for the preparation regarding the instruction of collecting the data. Could you go, please, Faith?
All right, so colleagues, in terms of collecting the data, the tools that we are going to use, how is this going to look like and all that? First, what we've done, all the 17, in fact 16, we are still missing a representative from Sierra Leone. So if anyone really knows someone from Sierra Leone, we are happy to engage with them because it's part of those countries active in that challenge, but then we've not got feedback from the people that we've contacted there. Putting that aside, how are we going to train our team? So we've developed these tools carefully. And we've really wanted to not only just say yes, no, but go into that depth of what is happening. So with that, we have been able to get back to the 16 people that are going to be the data focal point people. In that, we've given them the fact sheet through the consent form that highlights what the project is all about. What are the objectives? How will they be involved? What their roles are? What is it that they should use as they collect the data and all that? We've also given them a tool, the hard paper document, the soft copy one, because in MS Forms, the online platform that you're going to use is pretty much you click on the link, give your consent, and begin to enter your data as per your country. In the data collection platform, it's going to capture who is entering this data for that country. Of course, upon publication and all that, those are confidential things that we won't be sharing and all that. So how will the data collection pretty be done? It's through a survey that we will give to the team, and they will utilize that and all that. For now, we are giving them this whole week to read and appreciate the documents and understand, and if they have any questions. It would also be good if we have, before we begin data collection, a group webinar, so that we really hear from every person if anyone has any questions and all that. Then by the time we provide them with a link, they are really well conversant with their roles. So after this, we'll be doing a webinar with the data focal people from each country. I hope I've answered that question right well.
Thank you, Faith. That's enough question. That is clearly parallel. A tough week waiting for those data collector focal persons, including me, to read an overview of everything regarding the data collection phases and to set up a plan to prepare data collection for all of that. Meanwhile, we have a question from Aurora Dimela. She's asking that she's applied to take a part to the data collection, having got reply to know if I was chosen or not. How do I know what's next? That means that for those people who have applied to be a data collection, they didn't hear back. So he needs to know what's happening to him.
So we just made a selection this week on Monday and got back to the people who we selected, I think on Tuesday and all that. So we are waiting to hear from these people who we've chosen, if they are taking up the role and they are taking it on. If they are not taking up the role, then we select the second person in that country. And after we've heard from everyone and all that, then we'll get back to those who haven't been selected to be the data focal people, but introduce them to those who are the data focal people in their country, so that they see if they would want to work together. That is the plan. Yes.
Thank you, Faith, for this answer. I think it's good to introduce all of them to each other to make sure that the work is done 100%, because it is a countrywide data, also to facilitate the issue of data collection. Maybe in some African countries, this data is not will be anyone have access to it. Maybe they're using the network to access the data. That will be an advantage for the country, and to know that their actual data is collected by appropriate manner. So for now, if we don't have any further Q&A or other questions or comments, we will move to Prof. Ruzi to give us a closing remark about the session. Prof. Ruzi, it's over to you.
Okay, thank you. So I think something that it would be nice to talk about here is about the development of nursing capacity for this kind of work. And what I have seen in many countries, and this includes the UK, is that it's really important for us to keep developing skills and knowledge to help us with research with evidence-based practice and with collaboration. And the concept of lifelong learning is really important. And I think nursing leadership has a really big part to play in supporting nurses on that lifelong journey of learning and development. Within this project, we are working with a great librarian who is doing lots of database searching for us. And actually, I think that's the benefit of cross-country collaboration so that we can share resources. But also, there's a need to build skills and capacity in practicing nurses, so clinical nurses and nursing faculty as well, and to be able to make the case for access for more support, more development, more resources. It's really helpful to have those skills in research and evidence-based practice. In the UK, we're on a long journey to develop clinical academic careers, which is really exciting and requires good investment and support so that clinical nurses have access to supervision and support from faculty, and equally nurse educators and nurse researchers are embedded in practice. Now, I think for a project such as this, it's a perfect opportunity to bring together the different elements of nursing, whether it's nurse education, nursing research, nursing practice, and nursing leadership, because each sector of the profession brings with it different skills and knowledge. And I think nursing leadership can help us to formalise some of those relationships, but also build opportunities for informal coaching, informal mentorship, and shared learning. So I think that's one of the strengths of a collaborative project like this, in that we're bringing together lots of different strands. And there'll be lots of spin-offs as well, because once this state of nursing leadership is established, the current situation and that contextual analysis of each country's situation, that means that each country will be able to identify its gaps and its needs and use that to start to advocate for further development. So I think in terms of this project, it has a huge potential to bring people together and to progress nursing and the impact on population health outcomes, nursing's ability to affect health policy, and for nurses to be truly recognised within the multidisciplinary team. We've seen globally huge demand on nurses through the pandemic, and in the face of conflict. We have massive migration of populations across the globe. And again, that places more challenges for nurses and other health professionals. So there is definitely a need for very strong and passionate nursing leadership to actually support nurses in their good works and to try to help people in need. And the need has never been greater. And so I really congratulate the team coming together, and I think it could be the beginning of a really interesting model of research and development, and perhaps other countries will come together to work in teams to maybe follow the model that Faith and the team have established. And probably that's enough from me. Unless there's any other questions, but I think those were my thoughts as we went through the webinar. Thank you.
Thank you, Prof. Rosie, for such a closing remarks that remind us about the importance of this project and the way forward towards it. So for Meredith, which is joining us later, no worries at all. This session will be uploaded at the end of the session to the Nursing Now Challenges YouTube pages, so you can find all the conversation and all the discussions. For all other people that who missed the first part of the session, you will find it in the YouTube channel. Will be shared by Hannah via email for those participants by the end of this meeting. So thank you everyone for this very grateful and interactive session. Thank you our panelists. We would like to thank Prof. Lisa, Prof. Rosie, Munishi Nika, and Faith Nawagi for their fruitful input. Also, we'd like to thank our supportive team, Ms. Hannah and Andrea for their backing us and supporting us at all other time. So thank you everyone for being here on time, for learning such an informative session regarding mapping African governance lesson leadership documents, and for having an input. Really, I've been very excited and looking forward to see the outputs of this result soon. So thank you all. Bye-bye.
Bye, everybody.